So we're in the process of scrubbing in. Scrubbing in uses two mechanisms to diminish the bacterial, viral, and other contaminants in the forearms. So now that I've finished this process, what I'm going to do is go ahead and from the tips, I'm going to start using the water as a rinsing agent. And we always start from the top. And this is why when you see the movies and television, when surgeons are scrubbing in, what they're doing is they're using gravity so the water pulls all the contaminants down. And of course I'm making a mess. Nurses love it when I do that. And then what I'm going to do is I'm going to use one side to dry. And as I pat myself dry, I'm moving this textile around. And then I'm going to flip it. So again, I'm only using an area that is clean and not used. Once that happens, now I'm covering myself with a gown. This gown is completely sterile. Al revés. And as you can see, my hands are dry. Now I'm going to go ahead and don the gloves, which are also sterile. So now I've effectively created a sterile barrier between my skin and the patient. So we're going to go ahead and start the procedure. The other important thing is that basically everything we use inside the operating room has been sterilized and has been tested sterile with several different mechanisms to protect the patient from any infection. So we use the stringent criteria to keep that sterility and actually be able to guarantee that this patient will not have any contaminants in any of the instruments that are touching the internal organs. And even though a patient actually does have bacteria on their skin, the chemicals we use to clean that skin reach deep into the pores and diminish the bacterial and contaminant load in a very important way. All right, so that's what we wanted to explain during this procedure. Okay. All righty. Listo.